You know, if you're a pet owner, there is a pretty good chance you've had to deal with a painful, smelly, and just frustrating ear problem. They're one of the top reasons pets come to see us at the clinic, and it can be so distressing for you and for them. But trust me, understanding what's going on is the first step to making it all better. And it almost always starts with this exact question, right? You see them scratching away, shaking their head, maybe they're whining a little bit. You just know something's not right, but what is it? And more importantly, how do we fix it? Okay, let's dive right into this. In today's explainer, we're going to break down exactly why ear infections happen, what signs you can look for at home, and how your veterinarian is going to tackle the problem. By the end of this, you'll have a much clearer picture of what's really happening inside that itchy ear. So, what are we really talking about when we say ear infection? Well, the medical world has a specific, kind of fancy name for it. The technical term is Otitis externa. Now, don't let the name scare you. Otitis just means inflammation of the ear, and externa tells us it's happening in the external or the outer part of the ear canal. It's really just a clinical way of describing a very uncomfortable problem. To really get why our pets are so prone to this, you have to picture their ear anatomy. See, unlike our short, straight ear canals, a dog or a cat's ear canal is actually L-shaped. It goes straight down and then takes a sharp turn towards the head. That deep canal is just the perfect trap for moisture, for wax, for any kind of debris. Now, the cause of an ear infection is rarely simple. So to make it a little easier to understand, I like to think of it as a story in 3 parts. First, there's the setup, then there's the spark that starts the fire, and finally, there are the complications that fan the flames. So part 1, the setup. We call these predisposing factors. Now, these things don't cause an infection all by themselves, but oh man, they create the perfect conditions. We're talking about things like ear shape. Those beautiful, long, floppy ears on a basset hound, they trap humidity like crazy. Same goes for those hairy canals you see in poodles, or the naturally narrow canals in a Shar-Pei. And of course, if your dog is a swimmer, all that moisture just creates a warm, damp environment that microbes absolutely love. And here is a perfect, a classic example of that. The very thing that gives a basset hound its signature look, those long, heavy ears, is also what sets the stage for trouble. It creates this warm, humid little microclimate inside that ear. All right, let's move to part 2 of our story, the spark. These are the primary causes, the things that actually ignite the inflammation. And for dogs, by far, and I mean by far, the most common trigger for recurring ear infections is allergies. Could be environmental, like pollens, or it could be something in their food. For cats and little puppies, parasites like ear mites are a huge factor. And you know, sometimes it's as simple as something getting stuck in there, like a grass seed. And this gives you a really good look at what we're talking about. On the left, you've got ear mites under a microscope. These tiny things cause an incredible amount of irritation. And on the right, you can see some plant material that got stuck way down in an ear canal. Both of these are going to directly cause inflammation and just kickstart that whole painful process. And finally, part 3, the complications. So once the ear is inflamed from that primary spark, the whole environment inside changes. And this allows the normal, everyday critters that live on the skin, bacteria like Staph and yeast like Malassezia, to just multiply like crazy. These are secondary infections. They aren't the root cause, but they are often what causes the worst symptoms, that awful smell, the discharge. And if this keeps happening over and over, the ear canal itself can start to thicken, which makes everything even harder to treat. So knowing all that, what should you actually be looking for? Well, as a pet owner, you are the first line of defense. You're in the absolute best position to spot the early signs of trouble. The signs are usually pretty obvious, really, because these infections are just so painful and itchy. The big ones you'll see are head shaking and scratching. You might notice a funky odor or see that the inside of the ear flap looks really red and swollen. And then, of course, there's usually some kind of discharge. It can be anything from a dark, waxy brown to a yellowish goo. And listen, any sign of pain when you just touch their ears, that's a major red flag. Here's a classic example. Vets have a fancy word for this, erythema, but all it really means is redness from inflammation. You can see just how irritated and angry the skin on the inside of this ear flap looks. That's a telltale sign of an active problem. And here's that discharge we were talking about. This is that dark, waxy, what we call ceruminous buildup. It's usually a lovely mix of wax, dead skin cells, and junk from yeast or bacteria. Seeing this is a very strong signal that it is time to call the vet. All right, so you've seen the signs, you've made the appointment. A trip to the vet can be a little stressful, so let's just pull back the curtain on what's going to happen. The goal is to figure out not just that there's an infection, but what kind of infection it is, and this is the important part, why it started.
It's a really methodical process. First, we'll do a gentle external exam. Then comes the otoscope. That's our lighted, magnifying tool that lets us see all the way down that L-shaped canal right to the eardrum. While we're in there, we'll use a little cotton swab to get a sample of that debris. And that sample, well, that's the key to the whole mystery.
And this is where it all connects. It's like being a detective. On the left, that's our view through the otoscope. You can see that inflamed canal. And on the right, that's what the sample looks like under the microscope. See those little purple peanut-shaped things? That's Malassezia yeast. Seeing that tells us exactly what kind of medication we need to use. Now, a really important point here. If an ear is extremely painful, trying to poke around in there can be almost impossible, and it's certainly not fair to your pet. In these cases, your vet might recommend sedation. This isn't just to make our job easier, it's 100% for your pet's comfort and safety. It lets us do a really thorough, stress-free cleaning and examination. Okay, so the good news in all of this, and there is really good news, is that with a proper diagnosis and a solid treatment plan, almost all ear infections can be managed successfully. There is definitely hope. Treatment isn't just one thing, it's a whole game plan. It nearly always starts with a deep, gentle cleaning at the clinic to get all that gunk out. Then comes the medicated drops for you to use at home, and those are picked specifically based on what we saw on that microscope side. We'll also use anti-inflammatory meds to bring down the swelling and pain. But really, the most important part for long-term success is finding and treating that primary spark, the allergies, the mites, whatever it was. And, of course, a follow-up visit is so important to make sure the infection is truly gone. So here it is. If you take away only one single thing from this entire explainer, please let it be this. Just treating the bacteria and the yeast is only treating the complication. True success comes from working with your vet to find and manage that underlying primary cause. That is the only way to break the cycle and keep your best friend comfortable for good. Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.